BSI, my scene looks safe. Is it safe?
Yes.
As I look at the scene, I seem to have one patient. Is this the only patient that I have?
Yes.
Do I have any bystanders?
Yes.
Okay, I'm going to request ALS assistance as my patient seems to be in a minor amount of distress, and I'm always going to consider taking any C-spine precautions if they are necessary. As I approach the patient, I see a probably around 10-year-old female white patient who seems to be in a minor amount of distress. I am now going to approach the patient and talk to the patient. Hello, ma'am. My name is James. I'm an EMT. May I help you today?
Yes.
Okay. Can you tell me why you called the ambulance today?
I'm having trouble breathing.
You're having trouble breathing? Okay. All right. Well, I'm just going to ask you a couple questions to ensure that I can do what I need to do to help you out. Is that okay?
Yes.
Okay. All right. What's your name?
Julia.
Julia. Where are we right now, Julia?
We are at our house.
We're at the house. Okay, good. Can you tell me what time it is? Just completely roundabout.
5:25.
Good. Yeah, 5:25. Good. And can you tell me what you were doing a couple seconds ago before you were with me?
Studying for my test.
You're studying for your test. Okay. All right. Good. So the patient is CAO times 4. Seems to be able to maintain their own airway as they are speaking to me. But however, the patient said they were having trouble breathing, so chances are the patient probably has slightly labored breathing. So I'm going to go ahead and give Julia 15 liters by non-rebreather mask of high flow O2. I want to ensure that she can still breathe, that she is still getting plenty of oxygen throughout all the cells in her body, and that her airway does not close up anytime soon. Okay, I'm going to quickly check Julia's pulse. Okay, I'm going to check her skin. Everything seems to be all good there. I'm going to do a quick body sweep, check for any deformities, blood loss, or anything like that. Everything seems to be good there. I'm going to package Julia up. I'm going to take her to the hospital. I still want that ALS unit. And what I'm going to do is I am going to see if the ALS unit will rendezvous with us on the way to the hospital. Okay, all right, I am now going to begin taking my sample on OPQ-RST questions. Julia, so you said your symptoms are you're having trouble breathing, right?
Yes.
Okay. All right, can you tell me if you have any allergies?
No.
No? Okay, no allergies. Do you take any medications?
Yes.
What do you take?
Albuterol.
Albuterol. Do you take anything else?
No.
Okay. All right. Can you tell me, like, if there's any sickness that you have that I should know about?
No.
You have asthma.
I have asthma.
You have asthma? Do you have anything else?
No.
Okay, great. Can you tell me the last time you ate?
15 minutes ago.
15 minutes ago? Okay, what'd you have?
Stuffed peppers.
Stuffed peppers? Okay, stuffed peppers. Sounds good. All right, and can you tell me what was happening before I got to you? I believe you said you were studying, right?
Yes.
You're studying for your test? Okay. Okay. All right, just a couple more questions. So what were you doing that caused this asthma attack?
Just happened.
It just happened, okay. All right. Does anything make the difficulty breathing better or worse?
No.
Okay, no. Is it just like trouble breathing, or do you feel like there's like pressure on your chest? You can
just trouble breathing.
Okay, trouble breathing. Okay. And then you don't have any pain, so it won't radiate anywhere. Can you give me like a scale of 1 to 10, 1 being the least trouble you've had breathing, and 10 being the worst it's ever been? Can you give me like a 1 to 10? Can be any number you want. 8? Okay, all right, 8 out of 10. All right, and then when did this start?
10 minutes ago.
10 minutes ago. Okay, 10 minutes ago. Okay, all right, Julia, I'm going to now take a couple vital signs from you if you don't mind. All right, let's start with your blood pressure. Do you have a preferred arm?
No.
No? Okay. All right. Let me lift this up real quick if you don't mind. Try to keep your arm straight this way, okay? Thank you. Wow, which arm is this? This is your arm. Okay. Alright, try to just relax your arm for me. Okay. Okay. Sorry. Alright, so Julia, you seem to have a blood pressure of 112/82. I'll go ahead and write that down real quick. Okay. Alright, now I'm just going to check for a couple other things. Just try to relax for me, okay? Oh yeah, sorry, I'll take this on instead. Alright, Julia, you seem to have a pulse rate of 84. I'll give you a second, I forgot to check one thing. Here, let me see this hand real quick. Actually, not give you this hand. I just want you to, okay, just lean forward, try to relax, okay? Okay, Julia has a respiration rate of 10. Last thing I'm going to do, Julia, is I'm going to check your lung sounds. Considering that this patient is supposed to have a simulated asthma attack, I would say that that rate would probably be much higher, but obviously Julia does not have asthma, so let me check your lung sounds, okay? Alright, take a deep breath in. Out. Okay. In. Out. Okay. In. Out. In. Out. Okay, good. Alright, lung sounds are clear and equal bilaterally. However, if this was an asthma attack, it would probably be wheezing in at least 2 to 4 fields. Okay, alright, Julia, so based off my examination, I'm going to take the idea that you are probably going through an asthma attack. Do you happen to have your albuterol on you?
No. Yes.
Okay, great. Alright, so this is Julia's albuterol. Albuterol is a suspension. I'm going to shake it up. I'm going to ask Julia how many puffs do you take?
1.
Okay, Julia takes 1 puff, so I'm going to tell Julia, breathe in, breathe out. Okay, alright. Now what I'm going to do is I'm going to tell you to breathe in, breathe out again, and then when you breathe in the second time, suck in the albuterol, try to hold it as long as you can, and then breathe out, okay? Breathe in, breathe out, Breathe in, suck in the albuterol, hold the breath as long as you can, and then breathe it out whenever you feel that you need to. You can breathe out. Okay, alright. So we are on transport to the hospital. I'm going to do a quick body assessment of Julia. Just lean back for me. Going to check the clavicle. Clavicle looks good. Sternum looks okay. Can you breathe in for me? Breathe out. Okay, good. Everything looks good there. Can you lean forward for me? Just let me know if any of this hurts. Did it hurt when I touched your chest?
No.
No? Not at all? Okay.
No.
Alright. So everything seems to be good with Julia. Now that I've given her albuterol, we will say that some time has passed. It seems that Julia's condition is improving. So I will going to consider Julia a stable patient as of now. So I'm going to reassess Julia's vitals every 15 minutes. I'm now going to make my radio report. So I was dispatched to a patient about 10 years old, female, white, who complained of having difficulty breathing. Upon arrival, the patient's blood pressure was 112/82, had a pulse rate of 84, had respirations of 10, lung sounds were clear and equal bilaterally. As I said, the patient had complained of trouble breathing, reports no allergy, takes albuterol. I assisted the patient with her one puff of albuterol. Patient reports having asthma. The patient's, I guess the asthma attack as of now would be 20 minutes ago. As I said, I gave the patient her albuterol. Condition seems to be improving. I'm going to check and reassess her vital signs every 15 minutes. That's all I have for you. Thank you.